Hi guys, it's Dr. Selene with BU Medical. I want to talk to you about our multiple syringe packages. It's the way I almost only go. So we have a 3 syringe package, a 5 syringe package, an 8 syringe package, and a 10 syringe package. So when people hear that, they often get intimidated by that number of syringes. There's no reason to fret. So remember that each syringe is only 1/5 of a teaspoon or about the size of a blueberry. So if you're stressing and you're thinking, oh my gosh, you just recommended for me the liquid lift, which is our 3 syringe package, it's only 3 blueberries. It's not very much. And 5 syringes is 5 blueberries, 10 syringes is 10 blueberries. And a guide that I give you kind of as a metric to know how many syringes you're going to need as a very general rule is per decade you require 1 syringe. I'm in my 40s, I would require 4 syringes. Ellen's in her 60s, she's gonna require 6 syringes, which is what we're gonna do today. And so don't let that volume intimidate you. Most people think of the cat lady when they think of multiple syringes. That's not the case at all. If filler is placed correctly and thoughtfully, it still will be a very subtle result. Now, you will notice a difference, your mama might notice a difference, and your best friend might notice a difference, but that doesn't mean that the whole world will notice a difference. Initially, there can be a little bit of bruising and swelling, which is to be expected post needles in your face, but after about a week, it settles in. It takes about 2 weeks for it fully to integrate into the tissue so you can see your ultimate results. Remember, this is one little tool in our tool belt that helps us rejuvenate volume. And it is our Band-Aid. So don't think that this is curative. It's actually a Band-Aid that's helping give us back our volume. I'm gonna show you on Ellen's face the areas that she has lost volume and how I'm gonna approach it in a thoughtful way to rejuvenate. You'll see on her face as well, she's got a lot of sun damage from living in Florida, which is normal. So I would also want her to be on a really strict skincare regimen as well as lasers and Botox. So this is not a one size fits all for filler. This is one little tool in our tool belt of many modalities that we have for a holistic approach. Remember what we do today, which on her we're going to do 6 syringes for those 6 decades of her life. We're going to add on top of that later on lasers. We'll probably even repeat this filler technique again. And remember, to catch you up, we may do 3 to 10 on your first visit, and then we might repeat that all over again. So don't be intimidated. Your initial investment is large, but once we get you to a good state, we're on maintenance mode. At minimum, if you're getting a 3 syringe, I typically recommend that annually. You may not need it that often, but that's what I have you plan for in your head. So let's take a look at Ellen. I'm going to show you how I assess the face and how I determine where she needs the volume. All right, so I'm doing an assessment of Ellen's face. I can see that she needs a little bit of Botox, not our priority today, but we could just soften these little fine lines that she has in her forehead. I can see that there is sun damage in the lower part of the face. Again, that I'm gonna approach that more with laser, and you'll see me put a little bit of filler in here to soften these fine lines. The main thing that I'm gonna try to approach her with the filler technique is to lift this up. So I'm gonna put a little bit of volume in that mid-face. You can see this malar crease right here and right here where she's lost volume and her fat pads have separated a bit. So my goal is to go in this line, which you see sometimes you'll see your injector inject you up in this area of the face, and the reason being is you can see if I do a little finger tack up, what a difference that makes in her lower face. It's obviously not a facelift, but that volume alone to replenish in those areas where her fat pads have separated does cause that little lifting appearance, and it's going to rejuvenate that upper face as well as can soften some of the deficit in her under eye area. Look up for me, Ellen. You can see when she looks up, she's got a little deficit in here and here. So we can use a little bit of our filler investment to soften that because she's got beautiful eyes. So we want those to shine. One thing I've noticed is that if people put too much filler, they'll actually make the eyes look smaller. So we want to be really cautious with this. We want to maintain as much eye show as we can without making her look too tiny in that zone. So we're going to do the same thing over here where we're going to lift her up in this trajectory. So we're going to lift, and I'm probably going to use 2 syringes on each side for that. At minimum, I would say to use 1 and 1. So irregardless of your age, if you're looking for a lift, the minimum we're going to do is 1 syringe and 1 syringe. Then we can see in her lower face, she's got a good chin, but we could potentially put a little bit of volume in there because it would just soften that lower face profile. It's not something that a lot of people think about, but it actually does make a big difference on the lower face aesthetic altogether. And then as I move up from her here, her lips look really good. We've worked on those in the past, so that's not a huge priority today. But another priority would be these nasolabial folds and these oral commissures right here that you can see are giving her a little bit of a downturned look, and we just want to soften that a hair. The other thing that you'll see a lot on Instagram, which I think is a little limited, is jawline filler. So you see a lot of people put filler in this area. It takes a lot of volume. It can be beautiful. Do I think it's worth Ellen's investment today? No, I don't. And I do think you have to be careful with before and after pictures. A lot of them are based off of angles, and so I can make her look like she's had a fabulous result if I do a before and after that's at a totally different angle. Same with all filler, to be honest with you. If you see some people who show nose filler or cheek filler, if they take the after photo at a different angle, it's gonna look like you did revolutionary changes. That's just a photography thing. It's an angle thing. It's not really the filler alone. Or same with lip filler. If you see a before and after and the after is zoomed in, it's gonna look huge. So just be careful what your expectations are with filler alone. Remember today, she's gonna get 6 syringes, which is just a little bit over 1 teaspoon of filler. It's hardly anything, but you're gonna notice it's gonna give beautiful results that are subtle and will build on top of this over time. So I'm gonna clean Ellen's face off, make sure this is a really, really nice and clean palette. So make sure if you're coming in for multiple syringe packages, please do wash your face. If we are taking off a ton of makeup, we want to make sure this is super sterile and super clean for you. So we use both alcohol and a ChloraPrep for your skin. So it might be a little dry, but remember we want it super sterile and clean and no risk of infection. And you're gonna see as I inject, the skin starts to pop out at me, which is kind of what I wanna see as an injector, to see that I'm in a zone that is looking beautiful and lifted. And you can see how already just that little bit of volume helped minimize that malar crease. Okay, so we're gonna keep on going, add a little bit more volume. Remember, I'm not intimidated by volume. As long as it's placed correctly, it should not look weird. I know that it sounds intimidating. On Ellen, if we had all the resources in the world, I'd probably start her off with 10, to be honest with you. So we're starting off with her 6, so we're making a good dent, but I wouldn't be scared to add more at our next visit. And you know, filler is instant gratification, although it does take that full 2 weeks to kind of see your ultimate results. So be patient in the process. You will notice a difference right away. Part of that result that you're seeing is swelling. So don't get too excited, especially like with lips. You know, if you love them walking out, they are gonna deflate. So just be aware that if you love them now, you're gonna want more. If you think they're overwhelming and too huge, they're gonna be perfect in 2 weeks. So it's kind of just walking in with that expectation. So you can see I already did 3 syringes, 1.5, 1.5 on each cheek. I'm gonna add just a bit more, but I am gonna approach the chin, which is an area that a lot of people don't think about, but I actually do want to give her a little bit of a contour here. Again, if your injector recommends it, do go with their recommendation. They're looking at you from a holistic approach. So the thing that we have as humans is we only get to see ourselves in 2D. Everybody else gets to see us in 3D. So in 3D, you look actually quite a bit different than what you look like in 2D. You only get to see yourself in the mirror. You don't get to see yourself in 3 dimensionals. So if you have a trusted injector, do trust their eye, that if they think one little dot of product here or there is gonna help, they probably have a reason for it, because they're looking at you from all different angles, not just one. So this is how we do this little chin filler. It's not very painful, but it can be a little bit of volume in there, so it can feel a little bit heavy. And you can see how even that little bit alone makes a huge difference, and it's stunning. It's those little tweaks with filler that make her injections from good to fabulous. And you want somebody who's looking at you from a holistic approach and tells you, hey, I didn't even think about that. But look at that. I mean, huge, huge results. I'm gonna end Ellen's treatment. I've already given her a good base to lift, and profile her. So I've lifted, given her profile, and now I'm going to do cleanup. So this is my favorite approach for all fillers with most people, is we do a good base, a good lift, and then we're left with the finesse. So I appreciate if people give me at least 3 to 5 syringes to play with, because that's how I can get you the results that you're looking for. You give me 1 syringe, it's not going to make that much of a difference. So we package it so you guys can afford that, because we want you to get the results. And you can see it doesn't take that much longer to add that much volume anyway. So in this zone, I'm going to go really superficial because my goal is just cleanup here. It's nothing really volumizing. You got to be careful in this zone. We never want to make you 8-mouthed or not able to move around the mouth. So it's important that you go with a thoughtful approach to where you're placing this filler. Initially, it'll feel very firm, but it'll soften. Not all fillers are created equally. So one of the new rules, my new rules in the new year, is you don't get to ask which filler I'm using because you're trusting me to pick the right one for you. So remember that if you trust your injector to pick the right product for you. We know the rheology and the makeup of these fillers, and so we're doing what's best for you. It's not because we got a sale on something, or it's not because something's cheaper than another. It's really what's best for you. So a lot of the marketing with these companies is really great, and so you hear about some more than others. But the science is the science. So we want to follow the science in what is the most appropriate for your specific issues. We're never going to do a cookie cut approach and just say, just because we use this filler most of the time, it means it's appropriate for you today. So trust the process. Okay, so I'm just going to top off with a little bit of topical arnica as well as our liquid sunshine oil, just to kind of get this, lessen our chances of bruising. Remember, that's always a possibility. We just did 6 syringes. You can see how relatively unscathed Ellen is. We don't want her to be in pain or anything like that. And you can see not a bloody mess. Remember, this was a holistic approach to Ellen. I still want to see her in a few weeks once this is settled and integrated in the tissues, and I'll likely add more. But we'll see what we're left with and kind of see where we're at, which I think is already beautiful. So remember, if you're curious about fillers, give us a call. We can do a consultation. We can let you know exactly how many syringes we would recommend. You don't need to start off with that full number on your first visit if you're tentative. Again, I personally like to do at least 3 syringes when I initially see you, because I think that's going to give you the best results. Some people, I'll even say, just save up your money until you can afford it, and then we'll do it when you can afford it. Remember, guys, we want you to look great so you can feel great, so you can do great things in this life. Take care. Bye-bye.